Another very common question or topic of questions would be rhinoplasty. What is a rhinoplasty? Well, it's a nose job. Commonly, questions would be, can you just have the bump removed from the nose? Can you just have the tip made smaller? So the answer to those questions is yes, you can. However, it's not necessarily the best thing to do. So when you assess a person's nose, or when plastic surgeons look at the nose, they're not only looking at the like the size of the nose, but within the nose there are proportions. How long should it be compared to how much it should project out, how short it should be, how long it should be, how wide it should be. And if you end up taking like a bump off of a person's nose, the thing that makes rhinoplasty one of the most difficult procedures, if not the most difficult, is that every action has more than one reaction. So for instance, remove a bump, what happened? The tip falls down. The bridge is flatter and wider. You can see the ridges in the nasal bones. What happens if you just narrow the tip? Well, sometimes the tip, if you remove the cartilages, can get lifted. If you narrow this part and you don't narrow this part, it can make it look unnatural and lack proper proportions. So although a patient may come in expecting to just have a bump removed or just have something done, realistically, and what most patients want, is a natural look. You need to do a little bit to each part of the person's nose to give them the most natural look. The surgeon who's doing your procedure should be very skilled at doing rhinoplasties, and he should be able to, or she should be able to, explain that to you in detail about what is going to be done, why it needs to be done, and about how it's going to be done, if you want to listen to how it's going to be done.